Welcome to the What are Pre-appraised and Evidence-Based Point-of-Care Tools section of the EBM Express course. EBM Express is designed to build your understanding of evidence-based practice in short, manageable blocks of content. In this section, we will define pre-appraised and evidence-based point-of-care tools and select when to use pre-appraised or evidence-based point-of-care tools versus searching for other types of evidence literature. Besides primary and secondary literature, there are pre-appraised and evidence-based point-of-care tools. These are sometimes referred to as tertiary literature or evidence summaries. These tools combine different types and levels of evidence into one resource that is easier to use, and they are typically designed to be used in a clinical setting. Many of these tools will provide recommendations for care, and some will even grade the evidence that they are including. There are many of these tools. Some examples are subscription-based tools, like UpToDate, which includes over 13,000 evidence-based topics covering diseases and conditions, drug information, and other clinical subjects. Dynamed, which is a similar tool that also provides thousands of evidence-based summaries on a wide variety of topics. And Essential Evidence Plus, which includes around 1,000 evidence-based topics and is designed for primary care, emergency, and urgent care clinicians. There are also many examples of free tools, like Best Bets, or Best Evidence Topics, which are graded evidence-based reviews of topics in emergency medicine. Access, which is actually a search tool from McMaster University that only searches for pre-appraised evidence. And Prevention Task Force, which was formerly known as EPSS, and includes recommendations from the U.S. Preventive Services Task Force. You may notice that the subscription-based resources generally tend to be more comprehensive, and the free tools are more specific to a particular specialty or information need, although this is not always true. Now, let's look more closely at a couple of these tools. First, UpToDate, which is a very popular subscription-based tool. There is a mobile version, and it covers an extensive list of topics. You can see the typical format in this screenshot of the measles topic. UpToDate includes author and last updated information, which is clearly presented at the beginning of each topic. Topics include a detailed review with links to the evidence that is cited throughout. There is a table of contents on the left to help you navigate the information quickly. And many topics will have a summary and recommendations section, which quickly summarizes the key points from the review. UpToDate also includes helpful patient education materials. Next, let's look at Prevention Task Force, which is free and also includes a mobile version. This point-of-care tool only includes the recommendations of the U.S. Preventive Services Task Force. Due to the smaller scope of content, this tool is easily browsable as seen in the topic list. Each recommendation includes a detailed assessment, discussion of the evidence with links to citations, and a grade. You can access these features, as well as some additional features, by using the navigation tabs. Now that we have looked at a few examples, hopefully it is clear that these tools are great for clinical support. They can provide standard recommendations for care and an evidence-based review of a topic or a disease. They are designed to provide access to high-quality, pre-appraised evidence quickly. However, since these summaries take time to develop, these types of tools are not a good source when you are looking for information on emerging topics or need the latest research on a topic. They also can't address the needs of complex patients, which might need more individualized approaches. For these types of information needs, clinicians and health sciences librarians will need to search the literature.